Thank you so much, and welcome everyone to SHRM Tech 2018. I couldn't agree more on the importance of wellness, and HR people for many, many years have talked about work-life balance, but no one defined what that actually meant. And organizations that start to work from a more evidence-based approach really serve the HR professional well. So thank you, Krishna. Thank you.
Thank you, Brad.
Ms. Vadma. Firstly, heartiest congratulations.
Thank you.
I think this is a great report. I'm sure I'd love to read it and apply it to my workplace as much. But as I think about health, it goes beyond just diagnostics. It's a series of wellness efforts which today as workforce individuals or corporates have to take in the area of physical, spiritual, mental, and emotional. And I also believe very strongly that what gets measured is what gets improved.
Beautiful.
So this is a great effort in that area. Heartiest congratulations to you, and we look forward to seeing many such insights coming from your organization.
Excellent.
Thank you very much, ma'am. Thank you, Mr. Boyson. And with that, before I hand it over, a big round of applause once again for Mr. Boyson and Ms. Vadva for doing the honors along with Mr. Ulagrachagan. And ladies and gentlemen, Mr. Krishna Ulagrachagan, truly the man who literally has a finger on the pulse of India's workforce, and now he's going to be sharing highlights of Healthy Insights 2018 study.
Excellent.
All yours, sir.
Thank you. Where's the clicker? Sure. Excellent. Thank you. For most Indians, right, staying healthy starts with a health checkup and at best ends with a doctor consultation and a prayer. Right? For most organizations that are trying to battle the rising tide of chronic diseases and rising healthcare costs, right? We're implementing programs, right, like health check programs and health management programs within our organization. But we struggle with limited participation, right, and the lack of data that comes out of these programs that actually helps us understand whether we're making a difference, right? So we've been asking ourselves the question, right, does quantified programs, data-led and insightful programs help you actually make a difference within your organization? So over the last 3 years, we've worked with leading organizations and insurance companies to help look at how they can help improve the health of their employees and, by extension, the health of the families of those employees. Right? Through the programs that we have run, we've collected nearly 3 million data points, right, across various industries and across the country, right, that we've analyzed to look for trends, benchmarks, right, and insights that we can help apply. Right? Healthy Insights, the report that we have developed, is our effort and initiative to share this with everyone else. Right? So instead of going through the entire report, what I thought was I'll just share one slide from one industry to give you a sense as to the kind of data that we have collected and the kind of insights that we've been able to draw. Right? So I'm just going to focus on the chronic conditions within the non-IT services industry, right? So we looked at prevalence rates and incidence rates of heart disease, diabetes, stroke, cancer, and hypertension. All the most important chronic conditions and non-communicable diseases in India. What we've also looked at are what are all the lifestyle factors that impact that, right? And what it is that we can actually, and how are those trends changing year on year, right? We've got a large report, right, that we'd love to share with you that talks about different industries, talks about the benchmark that actually helps you understand how your organization's looking at, how your organization's doing in comparison to what the benchmarks for your industry are. Stop by stall number 4. Happy to share a copy of the report with you. And if you'd like for us to help you understand your data, come talk to us and we'll be happy to help you with that. Thank you.